welcome back everyone. And today we will be talking about the results section, a guide to write and present research findings. So our outline will follow these steps: the definition and importance of the results section, the key elements of the good results section, the structure and content with the use of tables and figures, the case studies from published manuscripts, some tips, pitfalls to avoid, and we will conclude our presentation. So the goal of this presentation is to guide students and researchers, young researchers especially, on how to effectively write and present the results section of your research paper and even your thesis. So specifically, it will help you to first of all describe the structure and components of the results section you are writing, to illustrate how to present the findings clearly using tables and figures, and to identify common mistakes and best practices to use. So let's start with our first chapter on definition, purposes, and key elements. So first of all, what is the results section? The results section that you'll be writing in your manuscript reports the findings based from the methodology that you have applied and the research questions that you have answered. So it bridges the methods and the discussion. To discuss something, you first of all have to present it. And to present, you first of all have to tell us how you did. So the results section should state the findings and arrange them logically, and especially without interpretation. So the results section also should be written in the past tense because it is something that has already been done. So you are just describing it. Yeah. What is the purpose? The purpose of our results section, it is aligned with our goal we set at the beginning. Answer the main research question posed in the background in the form of an objective using the data collected explained in the method section. So the result is mostly a bridge from results from the methods to the discussion. The results section may also highlight other pertinent discussion trends or insights revealed by data analysis. What are the key elements of the good results section? First of all, make sure to review examples of results section from sample papers or journal articles, because you could see that different journals will have different way of presenting their result. The structure, the content, the length, and the visualization of the data. Maybe graphs should be like this. Tables should be presented with either horizontal or vertical lines or none. Make sure to include the text in the past tense that presents and interpret the numbers while highlighting their meanings. Here, interpreting the numbers is not discussing them. It is giving sense and meaning to the number that you have presented. Make good use of paragraph breaks and subheadings to help readers navigate between the findings done. And finally, make sure to integrate visuals, tables, and figures to be complementary and logical to the text you describe. The table and the figure should really highlight what are already presented in the text. So overall, you should have a logical flow of your findings, a clear link to the research question, the use of past tense with objective language, the proper use of tables and figures, and the integration of both text and visuals. Now, after this introduction, what is the structure and content with the tables and figures that we will really see here? You should know the structure and content, first of all, by describing the participant. So when you start your results section, you describe the participant, the inclusion and exclusion criteria. You even put a flow diagram in case you have done so many different manipulations from the initial data or the raw data to the final data set, and you describe the demographics. It's mostly the first table. Because before presenting prevalence and other aspects of your result, we should first of all know how the participants are. So you describe their social demographic characteristics. Also present the summary of your key and central findings according to the questions you have posed yourself in the background. Use subheadings and paragraphs to arrange the findings in logical sequence. Really, it is important to use your subheadings and paragraph. It helps us not to be overwhelmed with all the numbers, figures, tables that you have presented. Use concise and precise words with a reasonable page length. If it is for like your master's or a thesis, yeah, you can present many things, you explain and explain, but for your articles, you really should be concise to present directly what we have to see. Also, for quantitative results, mention using p-values or confidence intervals or ratios, either risk ratios or odds ratios, and what you have been using. For qualitative results, mention categorizing them, the themes, the codes, and even the categories. For non-textual elements such as figures and numbers, such as figures and tables, excuse me, number them. Table 1 says this, table 2, and put the title when you present out the table and the figure. And finally, when you are proposing your results section, be sure that each section is complete and that each question has been answered. But what about tables and figures? You should note that tables, figures, and charts are not just optional, but they're essential. So they help you communicate key findings efficiently. So the table and figures present data in a clear and organized format. They present large volumes of data in a summarized way that is really efficient for understanding. They complement the text by providing clear and visual representation of data. The visual elements that are tables, figures, and even charts reduce the need for lengthy explanations in the text. So like we said at the beginning, refer to them in table 1, table 2, figure 1, figure 2. And each table and figure number must be titled and referenced. Apart from that, tables allow for the side-by-side comparison of different data sets, different variables, and different groups. They also, and figures provide a visual representation of trends, patterns, and relationships. Like this example, this is a table. We said a side-by-side comparison. You can see here that different groups are compared using the same table, the variables are used and are compared here using different groups from same day to this. The time of ART has been stratified to this place. So you can see that using this table, you can just have a short length of in your result. That is, female had and the time to ART during the same day was 66% and put like table 1. You see that you don't need to describe 52, 51, 67, 32, 48, 47. You have set something. You can compare it with one proportion from either another variable, and you put either into parentheses or just state directly that most of the data is presented in table 1. So you see how side by side, easy to visualize. Meanwhile, the figure can come and present a trend, a pattern, a relationship, something that you use to explain with a lengthy paragraph. We had the prevalence of 30%, the awareness was 27, why not awareness was 72. Then in the awareness we had what? No, you can come through a figure, you explain one line, and the figure now, and you state that figure 3 explains already the prevalence, awareness, and treatment and control of hypertension directly. So you see that you can even come to prevalence here, treated, control, but this figure in your results section will already help us to understand how you went from 30% to 7. So this is really the side-by-side comparison and the visual representation made by tables and figures. Now, let's go to a case study. This is a paper on hypertension among people living with HIV/AIDS in Cameroon, a cross-sectional analysis from Central Africa in the National Epidemiology Database to evaluate AIDS. So you can see here that the first after the result, there's this subheading presentation. And even up in the subheadings, you can see it is separated into paragraph. That is how we present clearly. Now, the first subheading is the description of the population. Even though you will not be working the outcome is not present in all of them, you at least present us who are they first of all. So of the 9,988 people living with HIV eligible, 908 were included for the analysis. You see that you describe the inclusion and exclusion criteria like a form of flow chart presented here, but in a descriptive way. And finally, the demographic characteristics. And you can see that here it is presented. You can say of this, you put into paragraph figure 1. When you say like that, it is the same thing as saying the flow diagram is presented in figure 1. If you can use both ways. So you see figure 1, you can explain it. Now, when you have, like you see here, table 1, figure 1 first, table 1, figure 2, figure 2, table 2, and continue. So you really name them according to their appearance and also to the information needed. So if figure 1 has like, first of all, a flow chart, and secondly, the description of your included participant with the prevalence, you get the information. This first paragraph only regarding the socio-demographic, you still state figure 1. And now the second paragraph here of the prevalence of hypertension, you take the second aspect of the information provided by figure 1 and still states it. So you can see figure 2 instead present the sex-specific drug prevalence, which is presented here. And we said that after numbering them, they should be named and cited here. So figure 2 is rate of blood pressure by, so you present really like it is made. Now, this is a second case study. The case study of determinants of retention in HIV antiretroviral treatment in the Cameroon International Epidemiology Database to evaluate its study clinics in the context of HIV treat or strategy. So results are always, there's always the heading result. You can see here that 445 potentially eligible participants were screened. We always start with a form of inclusion and exclusion of what was done. You cannot just put your results section, even though you analyze like 500 participants, you just say from the 500 participants is no. Before the 500 participants, how many were there? What happened before there was this reduced? So you can see here, if 445 were potentially eligible, 22 were excluded due to what? 13 transferred out, 4 transferred in, and 5 missing patients. So, and finally, in the end, data was abstracted from 423. You see that just with this, we easily understand the traceability of what was found till what was analyzed is easy. And now you start with the social demographic of the 423 that happened. You still come with the role of subheadings and paragraphs here. You can see that they are really detailed. Don't write too much. Present it directly on what you are doing. So when you are presenting it like this, you put the subheading, HIV clinical characteristic of what you wanted to present, ART retention, bivariate associations, and all. Here, you can see that the ART retention outcomes are described in table 2. And this is table 2. You can see how tables are presented here in this journal, a little bit different from what was done in the first case. But here you can still see a case to case, a side-by-side comparison between the bivariate and the multivariate within the cross-out ratio and the adjusted out ratio that was found. It really helped you to understand what happened and the changes that were made for the variable to be considered associated, for the factors to be considered associated or not. So you see here, instead of putting just a paragraph, it was said the ART retention outcomes are described in table 2. So you see directly what table 2 presents here. No need to so much describing. Meanwhile, you have just set a small paragraph at the end of the 24th month. Some patients were transferred out, were reported, they were lost to follow up, and you directly call on the ART retention outcome. That makes the reader directly look how the presentation is made by seeing the comparison between what was found. So in our third case study, you will see this is a qualitative. You have seen quantitative ways of presenting. It is on perceived patient satisfaction, barriers, and indication on engagement in antiretroviral treatment services in Cameroon within the HIV test and treat context. So, you first of all start with your results. Here it was renamed. That is, first of all, in results we have 3.1 satisfaction with HIV. And you see that the satisfaction is found in the heading. So we directly know what you want to. Barriers. These are 3.2 talk about barriers to patient satisfaction with HIV services, and 3.3 barriers to reported to patient satisfaction reported to have adversely impact patient. So all this, and you see even 3.4 on implications. So your heading will really, the questions that were asked in the background are responded in the result section using the methods that were done. So more than half of the patient expressed satisfaction with the general care provided at enrollment. So you can see here that the drivers to patient satisfaction are presented on table 1 below. And you directly see what table 1 is. Reasons for patient satisfaction. You see how teams, sub-teams, codes, how it is presented here. You see the qualitative aspect of it. You can only present codes without putting them into tables, into matrices, but you can still do the reverse and present them into matrices where they are even easily identified. So every time you are using abbreviations and all, you come here and you specify directly F were for female, like you can see here. The nurse called me and bought me a drink by LFA08. So F is female and L is from Limbe Hospital. So we can see here that it is a female from the Limbe Hospital. A means active patients and 08 is the number of patients is that she was number 08 included in the study. So that helps to maintain confidentiality and anonymization of the patient who can speak freely of the satisfaction that she had from the HIV service. You can see how it is presented. You also see how other ones are made. The main barriers classified under health system and individual level to satisfaction are presented in table 2 and table 3. So sometimes in journals, if a table is too long, it is better to cut it so that it is easily visualized. It's better when tables are just one pages so that each table should be in a particular page so that the reader should not be turning to have the information at the end of the page explaining what was done at the beginning of another one. You see. So you can cut it. You can cut it also according to the information presented. On our fourth case study on the factors associated with HIV status non-disclosure among people entering care at IDEA sites in Cameroon. Here we presented a sample flowchart because, as we said, the first thing is to always tell us how many patients were first of all found, how many overall. So the study population, a total of 17,000 patients were enrolled between this period, the period of the study, but 2,882 were eligible for inclusion. So when looking at this, you understand directly that 17,000, more than 15,000 and something were already excluded from the analysis. You see the description here. You can either have a short paragraph here saying that, okay, 13,000 were with no evidence of care, 270, or you can just say in one phrase and directly present here. So 2,800 were eligible, the exclusion was this, and the patient included in the study were done like this. Now, you can come to like table 2. The prevalence of HIV status non-disclosure was 34.4%. And you put table 2, non-disclosure was this and this, and we directly understand what happened. First of all, you see here all participants, you see the 34.4% here, you see. And now you come back to the side-by-side comparison that has been made. Tables are really nice to do this kind of thing. You see same day, 1 to 7 days, and you should compare according to standards because the results from your results section will help you discuss with other articles. If you just compare using your own standard with no proper scientific explanation, it will be difficult for you to compare. So result is not just to present, but it helps to prepare the discussion and the implications of this data. So you can see, and with most of the article, you always see that the table and figures, they always have something highlighted. They are like something shiny to help you really see that, okay, this number is not to be joined with the result. It is something to help you go directly to the table or the figure or the chart. So just with this paragraph, we are explaining, you see, every line here is having more than five different type of numbers. So if you just try to start writing it, you will not finish. Even 2 pages may not be sufficient to explain half of this table. But you can just go to the most important aspect. Important aspect can be directly according to you or according to the literature review. You just want to look at maybe the factors that are potentially associated. You look, or the factors that are even statistically significant, or the factors that will help you to describe. That is where you go to one particular number, one particular variable, and you just take it. Like here, we talk about non-disclosure male according to female. We took here directly the different ages, the marital status. We came here again and presented the education and income. So it really helps us to take each variable or each characteristic and directly pinpoint only a variable of interest for us. And finally, this is our fifth case study on the impact of medical supply donations, a post-donation survey in a critical access hospital in Douala. So here, always, a total of 59 completed responses were obtained from a total estimate of 68 eligible hospital staff members. You directly understand that it was first of all 68, and finally you have an analysis of 59, and it is presented here in the tables. So the survey included a diverse range of respondents and all. You present also in terms of roles, administrators, constituted of these, paragraph, subheadings, and paragraph. You always see all the 5 examples, case studies I presented. You always see the similarities. Now here, look at how the table is presented. When we look at maybe this figure 2, a smaller proportion, before going to the table, a smaller proportion came from donor, doctors, and other hospital roles, figure 2. You see that you directly, this is the 8.9 from figure 2. You see that they didn't report directly administrator or order, or you go to what is your interest. The authors wanted to mostly see at the proportion of responded by roles, especially from doctors, and now with other respondents. So you see that figure 2 is presenting more than 1, 2, 3, 4, 5, 6, 7, 8 different prevalences, proportions, but here in the description, it is only one. So that when you go to figure 2, you directly see the position of the doctor according to the different aspects. And you can see here table 3, where it was presenting stratification by department, revealed significant differences of 0.022, table 3 directly. So no need of telling us that 50% compared to 22% compared to 72% by clinical services, administrative, laboratory. No. Yeah, so at the end of our different case studies, we now come to what are the tips, pitfalls, and conclusion. What should you do when presenting your results section? We have been repeating it several times to write in the past tense, to use clear tables and numbered figures. Even the table should be numbers and cited, to maintain consistency in the units and variables. So if you're talking of the height in terms of meters, don't come back with centimeters in the table. Use the same unit everywhere. Ensure every research question is answered. We presented in the content that after when proofreading, look if every section is complete and research question answered, and report all findings, including the negative results, even what you were not expecting. You present it there. And what you shouldn't do, you shouldn't interpret your result. It is for the discussion section. You shouldn't use vague phrases to record your findings. We said you should be concise and precise and not use lengthy sentences. You should not confuse figures with tables and vice versa. If you really want to compare, like using the ARC time from same day 1 to 7 and all, it will be better presented in a table than a figure, and a trend will better be presented visually using a figure. You should, what you should not is include findings not related or not critical to your objective. A student can do research even if they are negative, but don't forget that even if they are negative, it's already from your research question. You ask yourself that you wanted to find this and you saw another thing. So you still report it. But if there are other findings really not related or not critical, they are not necessary or important for your result. And finally, you should not present the same data or same information more than once. You're presenting the prevalence in almost all the paragraphs. It will really be difficult to follow with the presentation. So to conclude, the results section transforms the raw data into scientific evidence because it is coming from the method and it will help for the discussion and the implications. It should be done with clarity, with logic, and with the use of visual representation and present so that it can help us determine the impact at the end of the discussion. You should remember that a well-written results section lays the foundation and prepares the reader for your discussion already. You already know the data that you use to discuss and where you will interpret these findings in the context of the literature and your research question. So it is the foundation for your discussion. That is why your results section should be clear, concise, logic, so that every number used in the discussion should already have a sense and a meaning from the results section. So these were the references used. Thanks for your keen attention and patience.